Good afternoon, everyone. On behalf of the Department of Nursing, Directorate of Medical Education, Government of Telangana, and UNICEF Hyderabad Field Office, I am Dr. Sri Krishna, pediatrician and UNICEF State Consultant. And I welcome you all to this webinar exclusively for nurses. At the outset, let me thank you all for sparing your time and coming forward and participating in this webinar. This webinar is live on the Zoom link as well as on YouTube. And let me thank you all, especially those nurses who have been able to spare their time after your duties and still watch this webinar. Apologies at the outset for a technical glitch because of which we had to share an updated link. But it's very heartening to note that we have a full house as we start. I now request Professor Vidyulata to please give the inaugural remarks, and then Dr. Salima Bhatia, who is the health specialist from UNICEF, to give her inaugural remarks. Vidyulata, ma'am, please.
Very good afternoon and a warm welcome to the third series of webinar on COVID appropriate behaviors organized for the nursing professionals by Department of Nursing, Directorate of Medical Education, Government of Telangana in collaboration with UNICEF. It's my privilege to welcome the esteemed panelists for today's webinar. Firstly, I welcome Dr. Sri Krishna, State Consultant, UNICEF, who is the main resource medical professional and also the moderator for today's session. I also welcome Dr. Salima Bhatia, Consultant UNICEF, and I welcome Dr. Sri Sailam, Vice President, Indian Academy of Pediatrics, Telangana branch, who will deal with greet without contact and maintaining physical distancing. And it's my honor to welcome Sister Annie Ponatil, Principal Vijayamari College of Nursing, Begumpet, Hyderabad. Sister will discuss the respiratory hygiene, psychosocial support, and discrimination issues. I also welcome another panelist, Mrs. M. Rajeshwari, who is President, Telangana Trained Nurses Association of India, Telangana branch, and working as Associate Professor at Apollo College of Nursing, Jubilee Hills, Hyderabad. Madam will deal with use of mask and crowd safety. I also welcome Dr. Uma Shankar, Consultant UNICEF, who will deal with hand washing, social media, and information related to COVID-19. Once again, a warm welcome to all the nursing professionals as well as students for this webinar. Thank you. Over.
Dr. Shri Krishna, would you like me to come in now?
Yes, ma'am. Please, Dr. Salima for her inaugural remarks.
Thank you. Thank you, and welcome everyone. We are sorry for the initial technical glitches, and we are really happy to see the number of participants. It's counting as we, talk. It's mounting. We are now to 264 participants, and I'm sure we'll be having many more participants during the training. That said, this is really very exciting because this is the third in the series of webinars, and it's known that in this era of COVID-19 and webinars, as the webinars go forward, the number of participants or the participation, becomes more and more difficult. So we are happy to see that your participation is continuing, and we really look forward to seeing more of you in the upcoming webinars. I would like to thank the Department of Nursing, Directorate of Medical Education, Government of Telangana, and especially Professor Vidyulata for her dynamic leadership in taking these webinars forward. And specifically, we would like to, we are going to be discussing COVID appropriate behaviors today, and we welcome our panelists, Dr. Sri Sailam, the Vice President from IAP Telangana, Professor Anne, who is the principal of Vijayamari College, Ms. Rajeshwari, who is the president of TNAI for the Telangana branch, and my colleague, Mr. Uma Shankar. So, Ms. Rajeshwari, I wanted to sort of take this opportunity to also say that we are excited to have TNAI with us on this collaboration, and we look forward to taking this collaboration forward. We are looking forward to bringing in better learning experiences and better resources for the upcoming trainings with your support. Yes. Also, Professor, just wanted to sort of ask you and request you that during either in this webinar or in the upcoming webinars, if you could share some information on the exciting scholarship opportunities that TNAI is offering. I was going through your newsletter and I was very excited to see that there are scholarship opportunities for our nurses. And I think this would be a very good...
Surely we will discuss, ma'am.
Thank you. Thank you. That would really be nice. And it would help our nurses to take things forward in their career. And lastly, of course, I would like to thank Dr. Sri Krishna, without whose efforts this would not have been possible. And I look forward to hearing the entire webinar. But before I close for the day, just one quick request. Dr. Sri Krishna will be sharing a Google link form, and it's interesting to hear your feedback on what topics should we consider in the upcoming webinars. I'm sure you all have a lot of queries. You all have a lot of questions. You would like specific topics to be discussed. And I don't think that this should be a one-way forum. So all the participants are requested to sort of share your feedback in the Google link that Dr. Sri Krishna will share. You know, we are looking for topics that you would like us to cover in the upcoming webinars. So with that said, I would like to thank everyone once again, and over to you, Dr. Sri Krishna. Thank you. Thank you. Dr. Sri Krishna, we're not able to hear you. Dr. Sri Krishna?
I think he's busy making arrangements
I can
regarding
imagine.
the video. Yeah.
Thank you, Dr. Salima.
Yes.
We'll begin our session now. Seems to be some connectivity issue with my voice. Audible to everyone. Sri Sailam or Uma Shankar, could you please confirm if I'm audible?
Yeah, you're audible, Dr. RSV. You're audible.
Right.
It's clear too.
So let's quickly begin our webinar. Today's topic is very exciting. The excitement is because this particular stage which we have reached as yet, wherein a lot is known to us in terms of prevention of COVID. And we have reached a stage where 1 in every 3 people you meet technically is already COVID positive. So it's very important for us, as the lockdown has stopped and we are finding our work to be a prime focus of the day's activity. It's very important to know what should be our behavior, what should be our lifestyle as we resume our work. And Government of India has recently released a document which is called the COVID appropriate behaviors, which means this is the new normal. A particular activity like going to a supermarket or saying hello to somebody has now a certain way of doing it. If you do it the wrong way, you end up getting COVID positive. So beyond whatever you're all doing in hospitals, which are selfless human service to all the sick people, it is very important that you take care of yourself. And the nurses are the backbone of the entire health infrastructure and whatever the government is doing right now. It's all credit to your good work. So it's very important for you to know what you should be doing once you are off duty from the nursing profession, or particularly for that particular day. So let us take you through this particular document, and I'll request all the panelists to please come in and then guide us on what needs to be done on that specific aspect. So let us begin with Dr. Sri Salem, and I request Dr. Sri Salem to please tell us more about the first aspect of greeting. How do we greet each other as part of this new normal that we are in, and how do we still stay in touch with each other? Dr. Sri Salem, over to you.
Yeah, thank you, Dr. RSV. As an opening batsman, the onus lies on me to welcome all, and I'm congratulate everybody, all the participants and the panelists today. And I'm happy, and I would like to thank the Almighty for giving us an opportunity to see another day. So today we are able to attend the webinar and able to serve as the frontline warriors. It is only because we are very responsible. Responsibility in not only keeping ourselves safe, but others also safe. As a part of this appropriate behaviors, the first thing, whatever generally we do is greet when we see somebody for the first time, or might be in the day. So it is why do we greet people? We greet because we want to communicate with them. That is the first method of communication. Sometimes we want to convey them that I'm healthy, I'm happy. And it is a sharing of love and affection. But we are in a very peculiar situation. That is the COVID crisis. So we have to learn new norms too. Next slide, please. Next slide. Dr. RSV, next slide. Slides. I have to change it? Yeah, I think till they get it, set it right. And so, and peculiar and very tough to convince the kids because they have the routine habit of hugging the elders. So whenever you see somebody not a member of a family, we should train them to that during this corona crisis, the things what appropriate method of greeting them. So in India, we are well accustomed to greet our elders or family members by saying namaste. So in this way, I think there is no physical contact. But in others, wherein the routine practice of hugging, giving shake hands, or in the Western countries, some of the European countries and in the Middle East, they have the habit of touching the cheek to cheek, or they might kiss the other person. So during Corona, I think what we have to do is, as a part of distancing, never touch the others. So while greeting also, try to avoid speaking out loudly, saying loud like good morning, good evening. Just gesture is sufficient. Mostly like say namaste, hello, hi. These are the gestures which we have to do during this corona crisis, and we have to learn it's a hygienic method also. Now, avoiding, yeah, physical contact is a very responsible behavior. So I said in the beginning that we have a very greater role also. Whenever some awareness program has to be done, the first choice would be the doctors and the healthcare providers. Why? Because many of them, anything regarding health and this thing, it is well conveyed by the doctors and the healthcare providers. So we as the healthcare providers, the great responsibility lies on us not only to treat the patients, but also to bring awareness in the society. And apart from the greeting, maintaining physical distance is another important thing. How to maintain a physical distance? This distance maintaining is not only in the crowded areas, but also at the workplace too. A minimum of 6 feet, that is, do gaj ki duri. So as you can see on the slide, 2 feet, 6 feet or do gaj. That is approximately 2 meters. So how you have to spread your hands in such a way that this is the distance between. So if the neighbor, whoever is standing besides you, he should also spread out, and your arm and his arm should not touch each other. So that is the minimum distance what you have to maintain. So the 6 feet distance, if you keep a distance more also it's appropriate, but a minimum of 6 feet has to be done. Why? Because of these droplets, they can travel to a distance of approximately 6 feet. So if you keep away from the person besides you at least 6 feet, then you can prevent this spread of this coronavirus. So this responsibility you have to learn, as I said, not only in the crowded places when you're going for a shopping, in the hotels, or if you're going to the hospital, you're at your workplace, in your offices, everywhere, this distance has to be maintained. So also allow, as I said, in the workplace also. So if the other person is infected, this physical contact may increase the risk of the transmission of the virus. So, do gaj ki duri, 6 feet has to be remembered. If you can maintain even more distance, it is well and fine. But a minimum of 6 feet. So, at the end of this program, you should know that it is 6 feet, the two numbers, 6 feet or do gaj ki duri. Over to the next panelist, please.
Thank you, Dr. Srisalam. So the next important point is on usage of mask. You mentioned that it is very important to wear a mask and maintain this physical distance. Professor Rajeshwari, please tell us the importance of mask. Who all should wear it? When should we wear it? And why is it now the new normal? Never before have we worn a mask when we went out in public. Why is it now a punishable offense if you don't wear a mask? And when all to wear, and how do we take care of the mask? How do we put it on? And then after we take it off, what care to be taken? Rajeshwari ma'am, please.
Yes, sir. Like people who are not suffering from medical conditions or having breathing difficulties may use the man-made, handmade, reusable face covers, particularly when they step out of their house. So once we go out of the house, we should wear mask and go. And this will help in protecting the community at a large. So it is advised that each one should have at least 2 masks to carry. So these handmade masks are very much important. I mean, it is easy for us to make in the home, like with the whatever the cloth, clean cloth available, and like we can wash it, and we can make the face covers or masks, and that should be prepared in such a manner that it can cover the mouth and nose completely and can be tied over the face easily. And each person should have at least 2 masks so that it will be easy for them to reuse. I mean, they will be, when it is moisture is, I mean, like within 5 hours or 6 hours, when it gets wet, they have to keep it. I mean, they have to take it out. They have to wash it with soap and water and dry it in the dry sun, and they have to that can be used. So each person should carry 2 masks. And how to wear the mask, like we should we have to wear the mask in such a way that it will cover the external parts, should face the downwards, and we have to see that it is covering both the mouth, I mean nose and mouth, and the complete face is covered so that the organisms will not enter into our face. And this is very easy, and homemade mask is very easily we can prepare ourselves in the home, and it can protect ourselves. Like we can make, if we have a sewing machine, we can use that sewing machine and prepare. If not, also we can take a cloth and we can make with a rubber band, the guidelines as per the government has given, like we can cutting the fabric cloth and make a face cover, and we can use that one. Otherwise, we can make even with the rubber band, I mean the cloth covered with the rubber band, and we can use that one also. And how this, I mean the mask will be like, how to make, it should be fit the face. I mean the face should be covered in such a way that there should not be any gaps from the sides. So it should be completely covered, and it has to be like, we have to, once we feel that it is wet, we have to remove it and wash it, and we have to keep it clean. Always we should wash thoroughly the face cover or the mask in the soap and water, and leave it to dry in the hot sun for at least 5 hours. And if we feel that there is no hot sun, we cannot make it, we have to go for it should be even used in the pressure cooker for boiling for 10 minutes at least, and we have to leave it for dry. And even though if you don't have pressure cooker, even we can boil it on a stove. I mean, like boiling, we have to clean it with soap and water and boil it. And that boiling for 15 minutes we have to boil, and then we have to dry it. Even this water boiling facility and pressure cooker facility and drying of the heat is not there. We have to wash the, mask or face cover with soap and water, and see that we will be drying it with ironing that one. So we are applying heat on that. Then we have to leave it for 5 minutes. Then we can reuse that one. And we can store each person should have at least 2 masks, and we have to see that it is well stored in a better place. Like it is recommended that we can keep it in any plastic cover at home. Like we have to take some plastic cover and see that it is cleaned thoroughly with soap and water, and we have to dry that plastic cover and see that the extra mask which is clean after washing, it has to be kept in that, and we have to store that and till we reuse. And we should remember that there are 3 key occasions where we have to use our face cover or mask. That is, we have to understand that when we want to go out, we want to step out of the house, we should leave the house with the mask. We have to go with the mask. And when we are talking with the people in any room, we should wear the mask. And we feel that we have cough or cold, we should wear the mask. The other person, whether the other side person is positive or negative, we don't know, but still we have to wear the mask. And remember, we should always think that we have to protect ourselves. We have to protect our family. That is more important. When we protect ourselves and maintain the ethics of wearing the mask, automatically the other person will understand the importance of wearing the mask. See, when we go out, we are seeing so many people still wearing the mask up to the mouth or leaving to the shoulder. That is not the correct way. We have to tell them that in the community, when we see anybody, we have to tell them that won't protect them. We have to tell them that you have to wear the mask in such a way that you are going to cover your nose, mouth completely. Then we have to see that if we are going out, we have to see that we are wearing the mask, and that mask, and mostly we have to see that without mask, even though we are having mask, still we have to maintain the distance. And when we have to wear the mask, we have to remember that it is not simply taking the mask and wearing it. We have to wash our hands. If there is a soap and water, running water is available, we have to wash our hands with running water. If not, at least we have to use sanitizer and clean our hands. Then we have to wear the mask or face cover. Whatever is available, we have to use it. Then coming to the mask, it is very much, unless we are going out, we should remember that we have to go with the face mask. And it should be a clean face mask.
Thank you, Rajeshwari ma'am. So it's very important for us to know the importance of mask. Mask does 2 things. One, it will not allow you to touch your nose and mouth frequently. That is the best purpose of the mask. You have it covered, your nose and mouth is covered. To touch it, literally you have to pull down the mask and then touch. So that is the first barrier. Second, it also allows you some protection against droplets which have come from people who have stayed very close. The most important is to maintain physical distancing. If the person is too close to you and they are likely to give some droplets, those come in direct contact with you, then the mask will be a physical barrier as well. So make sure you wear a mask whenever you step out. Without mask, no stepping out. From the social distancing and the mask, another important point is on the respiratory hygiene. May I request Sister Professor Ann, please tell us the importance of touching or not eyes and nose, which we all have to take care of. And this is not just in the hospital or in the nursing station, also at home as well and when you go out. Ma'am, please.
Thank you. Hi, everybody. It is my pleasure to be a part of this panel and to continue with the discussions. As already we have seen in the introductory remarks, that we are passing through the most difficult times in even the very existence is being challenged during in this millennium. Yesterday, I was listening to Dr. Raghuram Prasad sir, the Association of Surgeons of India president. He said, our healthcare system is very fragile. For us to cope with a big surge and becoming, even in the big surge of the COVID, even in the big cities, we have inadequate facilities and hence, it is very true that we should be, we should take precautionary measures and have some habits cultivated. Avoid touching your eyes, nose, or mouth. What brings back to my mind is that as early as the beginning of this pandemic, I remember having watched a WhatsApp message. Secretary of State of US, if I don't mistake, she was speaking about not to touch not touch with the hand your face. And in the course of the conversation, they showed it. Actually, it is not true. Just to show how habituated we are to touch our face, our nose, our eyes. She was all flipping through the paper, touching with the saliva and turning it. So it was like a fun shown, but I still keep in mind we have too much of a habit for anything. We touch anywhere and without our knowledge, we touch our eyes, we touch our lips, and we touch our nose, and we say that avoid. And the next slide says why. Why should one not touch with our hands? As we know, the hands. In the further slides, it said that our health is in our hands. To a great extent, yes. All of us know the hands have organisms, and much more we have to be careful about as we are facing through a difficult time of this pandemic. Can I have the next slides, please? And then, as I said, I would like to say a few words about, we have been hearing that we should not touch our eyes. Naturally, we know that from the eyes, from the nose, from the mouth, the organism goes into our respiratory tract, and it is at the alveoli. We have the real multiplication and the problems. Let me share with you a little of the pathophysiology of the COVID infection. I hope I will be not doing injustice to the topic given to me. And as we are all professionals, I'm sure it is good that we learn. After once the organism, the virus reaches the alveoli, we know the alveolar lining, it has the cells which has for the diffusion of gases. We all know the lining is lining epithelium consists of, there are two kind of cells that I like to do, the type 1 and the type 2. The type 2 pneumocytes are the one which has the receptors. Angiotensin converting enzyme 2 is the receptor on the type 2 pneumocytes. And the folks or the spikes on the or the virus, we are all familiar with the anatomy of the virus. The folks, there is the S spike which attached to this specific receptor, and as a result, this receptor of the type 2 pneumocyte, it is important to remember the type 2 receptor is one which secretes surfactant, and the surfactant is important for keeping the surface tension low and keep the lung expanded. And what happens here, because of this attachment of these spikes with the receptors on the type 2 pneumocytes, what happens is that the surfactant secretion is reduced, and as a result, there is a surface tension increase and the collapse of the lungs. And another problem is the inflammatory reactions that take place. We know that anyway there is an inflammation. There is the neutrophils coming in, and the macrophages stimulated, they produce specific cytokines like interleukin 1 and interleukin 6. And they enter the bloodstream, and they causes the vasodilation and increase the permeability of the blood vessels. As a result, there is extravasation into the interstitial space of the alveoli. And what happens is, finally, there are two things that the exchange of gas cannot take place, and that is reduction in the oxygenation to the blood, and as a result, hypoxia leading once again to pulmonary edema, and then we get this. Once again, the informations are sent to the hypothalamus, where we have the respiratory rate increased, and hypoxia leads to a chain of problems, all the symptoms that we talk. And therefore, consolidation at the alveolar level, the lung level, and then later it's leading to systemic inflammation in the blood vessels, and then later we have multi-system failure, and and with this, keeping in mind how important it is to have the respiratory hygiene. If our health system is inadequate, if once contacted, it is very difficult to get out of this dirty virus, and it is important. Its importance cannot be magnified more than what we say over and over again. The importance of maintaining respiratory hygiene, namely, very important to cover the mouth and the mouth and nose when you sneeze, when you cough, and particularly always carry the tissue with us, preferably. And if the tissue is not there, or the handkerchief is used, a handkerchief could be used. And then if not there, they are showing a person with it can be coughed into the bent elbow, and then later go and wash hands. Not only the palms, we should wash also where we have sneezed to. But suppose we are with a sleeve, once again it is all difficult. The best is we carry the tissue, or preferably tissue. I don't even advocate the handkerchief, because again, taking care of the handkerchief is another. Wash hands adequately immediately after the cough or sneeze. Okay, next.
Thank you, ma'am. So that's an elaborate explanation of the respiratory hygiene which we all need to follow. And a very interesting question which I've heard, and in few days, you all recall in the March, wherein WHO and all the other organizations had told us, mask is only for those who are sick. Mask is not for those who are healthy. And we all used to propagate this and tell everyone to wear a mask only if you're coughing. Please understand that, first of all, this disease is hardly a few months old. We have started seeing it in India only since last 2-3 months. Not enough is known about the disease. We are not very sure on the transmission. What we know little is from the information and which we have seen in our country, and also a little, very little, which I would say, which other states have shared. So based on that, we realized that wearing the mask initially, everybody, if they wear the mask, the number of times that you end up touching your mouth and your nose is very high. And in the process of wearing the mask, you are inadvertently touching your face. And that has probably been the reason why WHO as well as the governments had advised people in that particular stage of pandemic, wherein there were small numbers and the number of people who were affected is much lesser. In that stage of epidemic, the advice was to stay at home and those who had cough to wear a mask. In the current stage of epidemic, where we see large numbers, and yesterday more than around 900 people from Telangana state, each day we are having higher and higher numbers getting COVID positive. In the current stage of epidemic, everybody needs to wear a mask. And because we do not have the lockdown measures anymore, because there is better and more interaction with others, and we are not very sure if we can maintain social distancing, even if you really want to, in such circumstances, in this current stage of epidemic, at this current situation, everybody has to wear a mask. So it's a different stage and a different reason why that had happened. Now let me go ahead. We talked about how to greet each other, importance of a mask, importance of respiratory hygiene. Then comes the third very, very important aspect of hand wash. At this time, let me invite my colleague Uma Shankar to please take us through hand wash. I'll put up the video whenever you want, Uma Shankar. Please go ahead.
Yeah. So this I'm not able to access my video from here. My voice is clear, Sri Krishna?
Yeah, I'm back. I think the connectivity has improved at my end. I'll be able to play the video. Go ahead.
Okay. So greetings of the day. Good afternoon, everyone. And as our panelists have already talked about the important aspects, let me run you through the important aspect which talks about washing hands. So hand washing, మనము స్టార్టింగ్ నుంచి కోవిడ్ మనకి మార్చ్ లో వచ్చినప్పటి నుంచి మనం హ్యాండ్ వాషింగ్ గురించి మాట్లాడుతున్నాము. సో ద మోస్ట్ ఇంపార్టెంట్ ఆస్పెక్ట్ హియర్ ఇస్ అవర్ ఇట్స్ ప్రౌడ్లీ సెడ్ లైక్ యువర్ సేఫ్టీ ఈజ్ ఇన్ యువర్ హ్యాండ్స్. అంటే మీ చేతిలోనే మీ సురక్ష ఉంది. ఓకే, సో ఇన్ దట్ కేస్ దేర్ ఈస్ ఇంపార్టెంట్ దట్ every time you have to wash your hands, and that too you have to wash your hands thoroughly అన్నప్పటికీ ఇట్లాగా నలకా కింద చాయ పెట్టేసి నీళ్లు ఓపెన్ చేసేసి ఎట్లా తడుపుకొని, డోంట్ డూ దట్. యూ హ్యావ్ టు యూజ్ దట్ వర్డ్ విచ్ ఇస్ టాకింగ్ అబౌట్ థారోలీ. సో డెఫినెట్ గా మనకి ఫ్రీక్వెంట్ గా థారోలీ ఈ రెండు విషయాల్లో మనం గుర్తుంచుకోవాలి. 2 things: wash your hands frequently and thoroughly, and in the running water. Sri, next slide. Yeah.
Uma, I'm trying to put the video. Please go ahead.
Yeah,
give me a minute.
Yeah.
Yeah, Uma Shankar, I hope you can see the video now.
Yes.
I'm muting it so that you can take them through the video.
Yeah. This video, you can see the 7 steps of hand hygiene, how this gentleman is actually washing his hands. First and foremost, మనకు ఒక కోడ్ వర్డ్ ఉంటుంది, అది గుర్తుంచుకోండి, which is called SUMANK. So let's understand what is S. He is washing the hands the palms, which is Sida in Hindi, right? Yeah. సీదాలో కూడా మనకి ఫింగర్స్ మధ్యన కూడా వాడు కరెక్ట్ గా the soap is going and he is rubbing in between the fingers. Let's understand it with a code also, so that you remember whenever you wash your hands. This is Sida. Then the back of the hand, that is SU, that is Ulta. Then we rub in between the fingers and also the thumb. This is called mutti in Hindi, fist. Yeah. After the fist, you have this fingers, nails basically, which has to be cleaned on the palm. And this is Angutha. So SUMA, that is Angutha. We have already done with the nails. We have to rub the thumb. And finally, the K part comes, that is Kalai, which is called fist. This is the washing of wrist. So this totally becomes SUMANK. K is Kalai. You have to every time wash your hands in the same way in the 7 steps and wash in the running water. And dry it with paper napkin and put it in the dustbin. Hope this is very clear to all of you.
Thank you, Umashankar. So that's the importance of hand wash. We all know it, but let me share with you the reason why soap is considered the best weapon. Imagine a halo around your head or a crown on your head, and the crown is firmly stuck to your head. And if this particular crown has to be broken, then the head breaks. Coronavirus has got a lot of spikes, just like, let's say, my hair, it's got spikes, and these are all held by a lipid membrane. And this lipid membrane holds this together. If you are able to destroy this lipid membrane, then this virus breaks, literally disintegrates. You don't need any of these additional things which we all have to do if you can effectively use hand wash. What you are doing is breaking the bond of the spikes, which is the entry, which is facilitating entry of the virus, and all these protein spikes are on the lipid layer on the virus. So you break the lipid layer, the protein spikes are going to break off, the virus is going to disintegrate itself. You know, like every villain has one weak point. The weakest point for this virus is its ability to, or I would say inability to handle soap. The moment soap comes in contact, it will break itself, it will kill itself, literally. And I cannot overemphasize this point. Ask yourself if you have washed your hands 10 times since morning. Have you all done it? If not, soon after the session, go and wash it. The only way in which you can overcome fear is by 2 things. 1, better and correct full information, not half knowledge. Have the full information about what that virus does, how can it be killed, and that will give you the confidence and your fear will go away. The second is by sharing and caring. When you share this information, you will yourself understand the importance of it. I would have told it probably 100 times so far how the soap kills. And that is the reason if I am coming out of the room now, I'll make sure I'll go and wash my hands. If you cannot handle fear, the next few months will be very, very tough. All the sessions on, let us say, mental health, the yoga, the importance of immunity, Ayurvedic medicines or food, all of them will all work provided you understand why the virus is so dangerous and what is its weakest point. You attack it with soap and we are all going to be safe. Now let me take you through the rest of the presentation, and I request now Sri Salem to tell us how do we now take care of our surfaces. We are in touch with so many things, our mobiles, our purse, our pen, the nursing station, the nursing record. What do you think we could do to ensure that these surfaces are clean? Dr. Sri Salem, please.
Yeah. Now we're coming to a very important part. Every healthcare provider is surrounded in an environment or the area where he works or he's performing his duties is full of microorganisms, and so is the coronavirus. So the whole environment where we are, it is full of microorganisms, and this virus, I tell you, it can survive for several hours to days. So we are more susceptible, and our environment can be a medium for transfer of disease also. So as a part of our next responsibility is to have a thorough knowledge how to keep the environment and how to clean it and how to make it safe. So this practice of creating a good environment and hygiene, the onus lies on all the healthcare providers, at be it a nursing staff, be it a IMA, or be it a ward boy. No, in the beginning itself, the headlines was, the topics was bringing a behavioral change. It is very tough because even in my hospital, to ask the nursing staff to do the hand wash properly, asking them to wear the gloves for sampling or touching a patient, and asking the IMA to dispose of wearing the gloves, it is very tough. As a senior IMA here, she keeps on saying, sir, I've been working for more than 30 years in a hospital environment. I'm never ill. So not everybody is lucky enough. It probably might be that we did not have any COVID case in our hospital. So that she did not acquire that. But the same attitude should not be there. As the time changes, it is very important for everybody to be responsible. So as a part of it, now how to clean the surface? Why I am telling is, in the hospital, we have two different surfaces. One is that is frequently touched by the hands. Those surfaces that are frequently touched by the hands. Those surfaces that are either minimally or never touched. For example, the flooring and the ceiling. They are either minimally touched or they're never touched. So the cleaning process for them is different. Whereas for the surfaces where it is frequently touched, for example, the table, the reception table to start with, or the equipments, the devices, what we use in the hospitals. For example, the thermometers, the pulse oximeter probes, the ventilators, the dialysis equipment. So there are several other equipments too. So these surfaces which are more frequently touched, like for example, the door knobs, the door handles, the switchboards. So all these are surfaces that are frequently touched. And for example, if you have curtains also, the corners of the curtains, they are the ones which are frequently touched by hands. So we should know how to disinfect them also. So at the end of this program, the takeaway message would be the two disinfectants that you have to know before going away from here. One is the ethyl alcohol, the spirit, which should be above 70%. Spirit is usually higher in concentration, but the hand sanitizer, what you are using, ensure that it is above 70%. Other one is the sodium hypochlorite solution, which is readily available either directly as sodium hypochlorite, or you can make it at your own setup by adding 1 scoop of a bleaching powder into the water. So this sodium hypochlorite solutions are available in different concentrations. So for example, you take a hypochlorite solution of 1%, which is available, or either 10%. Now, for routine use for disinfecting the equipments, we should use 0.5%. So, for example, if you have a 1% sodium hypochlorite solution, so you take one part of sodium hypochlorite and add with the normal water, the tap water. So if you have a 10% one, you add 1 liter of this sodium hypochlorite 10% with a 1 liter with add it with 4 liters. So to get a ratio of 1%. Now double it, you get a solution of 0.5%. If you want to clean or disinfect a spill, for example, somebody vomits or a small child urinates, or if somebody coughs out. So small spills, you can disinfect it with 1% sodium hypochlorite. But if it is a larger spill, then the 10% hypochlorite solution has to be used. Now, sodium hypochlorite again is a bleaching agent. So when you're using it on surfaces which are colored, ensure that you have to know that it causes discolorization. Now, the spirit, where you have to use it? Cleaning of the stethoscopes, cleaning of the equipments, and some of the plastic which are transparent. If you use spirit, they might lose the translucency. So those surfaces you have to clean with sodium hypochlorite. Whereas thermometers, stethoscopes, and your probes, they all have to be cleaned with the spirit. Now, there are surfaces, for example, equipments, pulse oximeter or the monitors, those should be covered with some plastic cover which is non-porous and which can be protected, so that if you tie a sling onto the knob of the pulse oximeter or cover it with a plastic cover, then you can touch it frequently. So these are the methods by which you can keep the environment safe. This safety is not only for the patient's sake or transferring from one person to another. Important is it is for your safety too. Do not forget that whatever we are teaching you here, the first thing is keep yourself safe also, with the concern of the patients too. So whenever you are doing disinfecting any surfaces, remember, wear the gloves. We are seeing so many videos on the news channels also. There are people who are cleaning without wearing the gloves, without wearing the proper masks. That is not heroic. It is almost suicidal. So the important behavioral change which I wanted to bring in you is that you think of your safety also. So if you wear a gloves, if you wear a mask and use the proper method of disinfectant, I think we are all safe. So these droplets.
Thank you, Dr. Srisalam.
Yeah.
Yeah. So very useful points. So two things. The more you try to decrease your direct contact with a permanent object, for example, the table, the chair, or let us say the pulse oximeter, try to have a barrier so that your contact comes down. Secondly, whenever you clean, please wear gloves. In the process of cleaning, you may actually transfer them to your hand. So two very important aspects. Spitting in the open, we all know this is the eighth good practice. Every time you spit in a public place, you put yourself and also others' life at risk. Spitting will increase the risk of COVID because the organism grows in your throat, and you literally, when you're spitting, are taking the organism out and putting it into the open. So spitting is actually a punishable offense, and it is punishable by law. Do not spit outside. If you need to, kindly go to an appropriate place and only then you can spit. Next question, Rajeshwari ma'am, please tell us, we all now have to go to work. We can't help it. You can't. Earlier there was lockdown, so we may have had a reason, but now we all have to travel. What are the care that we can take when we can travel? There's a very interesting question on what I should do when I'm going in a cab. I'll answer that part. Request you to please tell us broad guidelines and what we can do when we are traveling and how we can avoid unnecessary travel. Ma'am, you need to unmute yourself, Rajeshwari ma'am. Yeah, go
Yeah.
ahead.
Travel only when it is absolutely essential. I mean, maximum we have to try to avoid traveling. But when when you want to step out of the house, try to wear your face cover or mask and follow the distance norm, that is 2 gaj ki dur or 6 feet. With that norms, like we can go out, but it is not like we have to go out means that is the absolutely it is a must, then only we have to go out. But we have to still we have to practice our hand hygiene and respiratory ethics, that is before you leave, wash your hands with soap and water for at least 20 seconds or use hand sanitizer with at least 60% alcohol. Once you reach your destination, wash your hands again with soap and water for at least 20 seconds or use hand sanitizer with at least 60% alcohol as soon as possible upon arrival. Avoid touching your eyes, nose, mouth with unwashed hands. Cover your coughs and sneezes with a tissue or use inside of your elbow. Throw used tissues in the trash and wash your hands immediately with soap and water for at least 20 seconds or use hand sanitizer with at least 60% alcohol. And still we have to practice social distancing during travel. Try to keep at least 6 feet or 2 meters from people who are not in your household. For example, when you are going and waiting at bus station or selecting seats on the train, we have to see that, because we don't know who are with COVID positive. We don't know whether, even nowadays we are seeing so many people without symptoms, so we cannot identify the people with whether they are positive or negative. So we have to always think that we are talking to a positive patient, somebody who is with a positive symptoms. So we have to keep that in mind, and we have to maintain our social distance, and we have to wear our mask, wear a cloth face mask when physical distance is very difficult. And we have to note that the cloth must cover should not be placed wherever we should not remove that and keep it here and there. We have to keep it in a place where it is not getting contaminated. And while traveling, like, we should not keep the mask with the babies like who are younger than 2 years, and anyone who are having a trouble, like especially this handmade mask we are not supposed to give to the people when they are going out who are having a problem of breathing or some problem, because that is not helpful for those people. They have to go for the N95 or other mask only. So we have to see that who don't have the problem, for them only we have to give. So traveling is always, if it is maximum, we have to try to avoid it. Is until unless it is essential, we should not leave out of the house. The other day during lockdown, like one essay, he was telling his mother expired in Andhra somewhere, and he is posted in Vijayawada. He was telling that literally I could not go, because if I go out to that place, like people, I have to pass so many checkposts, and there they may send me to quarantine. So why have to take that risk and go there? So I told my family members to make it like a video and show me the things all, and everything was done in the video only. So this is what, like, we have to think about ourselves, and we have to think about our family when it is absolutely needed. That is the time we have to go out of the house.
Thank you,
Otherwise,
ma'am.
we have to.
You've put it up very, very nicely. Go out only when it's essential. You going out might actually put somebody else at risk. Like that SI who felt it was a risk for all those 20, 30 people who came for the funeral. He took a very wise call.
Yes.
So make sure you're traveling only if it is necessary. I know you're all traveling to work. That is because it's necessary and you're saving somebody else's life. But if it's not necessary, don't just go out of the house because you're getting bored at house. This is one of the rare moments in life when people are asking you to stay inside and spend time with your family. Please do it. Recall all those days when you said, I don't have enough time for family. I have so much work. I'm not able to go home. Now you're asked to stay at home. Please stay at home. A few important points before I go to the next question. How is it that we can be careful when we are traveling in cabs? And the question came up in the chat box. Request all the participants to please write your questions, queries in the chat box. We'll take it up through the session as well. When you're traveling in the cab, please assume that, as madam has said, everybody around you is already COVID positive. Alane anukuni ellandi pratisari. Ekkadiki vellina atlane mind lo pettukondi. If that person inside is COVID positive, you still have to go to work. There is no point in getting scared and trying to limit yourself. What you would do is understand how the virus transmits. The transmission is because the person earlier would have coughed and the virus would have settled where? On the seat cover, on the door, door handle, or on objects. That is where it will settle, isn't it? So the first thing, maintain social distance. Don't travel in an overcrowded public transport. Second, if you're taking an auto, try to be the only person in the auto who is going. When you're entering the auto, make sure you're not touching anything unnecessarily. The bar, the rod, the seat, don't touch it. That is the best way in which you can prevent it. Virus will not come running and flying to you. You will have to go touch it, take it in your hand, put it in your mouth. Alane ostadi. Tanantata adi radu. So make sure you take all these precautions when you travel. Don't touch anything. Wear a mask. Even if you touch, that is your best guard. Every 5 minutes, literally every 5 minutes, take out your sanitizer, clean your hands. Hand washing another habit. And easy ga radu. Recall whether you have done yoga today morning, whether you have run 10 kilometers. Those are all habits. Alavatu unte roju chestamu. Lekapothe raavavi. Hand wash, hand sanitizer kuda alavatu. Cherchukovali. We need to put effort to make it. So wash your hand or use the hand sanitizer every 5 minutes. Don't touch your mobile and sit with it like that. If you take your mobile out, you touch the seat, you put your hand on your mobile, ఆ సీట్ మీద ఉన్న వైరస్ కాస్త మొబైల్కి వెళ్తుంది. ద డేంజర్ అక్కడతో ఆగదు. ఈ మొబైల్ ని మళ్ళీ మీరు ఇంటికి వెళ్ళిన తర్వాత మీ పిల్లలకి ఇస్తారు, వాళ్ళకి వెళ్తుంది, లేదా మీ అమ్మమ్మ తీసుకుంటది. సో don't try to do anything that will increase the chance of a virus settling on it. Eventual end point is your nose and your mouth. Try to cover it. In the means of traveling, make sure you wash your hands before you travel, and after you reach for the hand sanitizer whenever you can, and make sure everything, just imagine everything around you is there. Kani adi bayataki peddaga kanipistu undadu. So you have to assume you are traveling amidst COVID all around you and take all precautions. When you know, as I said before, when you know all about the virus, you will have confidence. And then you can even travel with the virus around you, provided you take all the care that is necessary. Amidst all this, there's a very important aspect of discrimination. We are hearing stories of doctors, of also nurses especially, being looked at as if they are infectious, even otherwise. We are all warriors, and I salute all the nurses who are doing the service selflessly every day in and out over the past few months, and we continue to do it. But still, how do we escape this discrimination? And a senior person, Professor Ann, please tell us two things. How do we tell ourselves not to discriminate somebody else? It could be a COVID positive patient. And how do we escape or tell ourselves something to avoid discrimination? Much part of it happens involuntarily. It is out of fear. So how can we not discriminate a patient? How should we conduct ourselves when we are getting discriminated? Ma'am, please.
Yes. Before I answer the question, two incidents come to my mind regarding this discrimination. There was in the newspaper sometime, maybe a month ago or so, a village, or rather, I think it was a slum, where the Hindus and Muslims lived very harmoniously, having a very good relationship, caring for one another. And once this COVID outbreak took place, they burned the entire houses of one of the religious group. And even the adults, the elderly people could not, it was very difficult for them to come out of the house, though someone rescued them. First, when I saw this point, I said, where is discrimination? But then I said, yes, there was, this incident came to my mind. Another time, another real thing happened in our own city. Some Manipuri students went to a shop for some provisions to buy. And in fact, those people took them for Chinese Chinese people, and they drove them away and did not give. They were in their utter desperation, went and gave a police complaint, and it was wonderful to see that the chief police officer, Mahesh Bhagwat sir, he himself took the provisions, went to the house where they stayed and handed over. So if you ask me, how do we stop this discrimination? It should come from within our heart. We need to educate ourselves that the people, especially these frontline warriors, including the doctors, nurses, and the health workers, of course, they are the frontline warriors. Together with them, you also have the police, the bank people, and the army. There are a number of people who make life possible for us. Once again, there was a video where it was shown regarding this compassion. A man in his house had nothing to eat, his son alone, mother is not there, probably held up in some Gulf countries. And the child said, Papa, I'm very hungry, and there was nothing to eat. It was that lockdown, strict lockdown time. And somehow taking the risk, he went out. And as usual, there are some people always ready to break the rules and go. So it happened, a policeman was standing on the road. A group of youth was just loitering, and he beat them up, and he saw this man coming. He also thought he's one among them. He beat him up. He went, yet he told that I'm going for buying the vegetables. He went, brought the vegetables and came back home, cooked the food. It was a very heart-touching scene to see that the first thing that he told, son, you eat. And he packed up the food, went to the police officer. And when the police officer saw that he's bringing food, he asked, are you not the one whom I beat up? He said, yes, sir. But I know you have been working for us from morning to evening. I think the endless, this is where the compassion goes out. And there was another in Nilafar, not to go far away, one of the doctors having 2 small kids. She couldn't go home. And the tearful, saying bye to the children and the husband, and she stayed away from the family. I also know of a number of doctors, nurses who cannot go home. And also there are a number of people who the landlords do not allow the nurses or doctors or whoever is, if they are staying in the rented houses, they are not allowing. So we need to, at this point of time, we need to educate people, and the empathy, the compassion that will come only from a human heart, the assurance and respect for the other person. Because if I am in that place, if they are not there, what would happen? So there are a number of questions, each one we need to address this problem. It's not a small thing. Our people need to be educated, and the compassion comes only from the heart, a heart of a person who could be, the heart of compassion comes from, that the humanness within you, and we are all humans created to share this compassion for one another. I have endless incidents in my mind, I think, but this will not allow me, this forum will not allow me to share the many incidents where people have been kind, people have been rude, but we, on our part, we as health providers, when we are people who educate others, have to be first convinced that, as the previous speaker and the chairperson spoke, we can walk through COVID, we can walk through the areas, but we need only to protect ourselves. And may we have a heart of gold that as these frontline warriors go sacrificing their lives, sacrificing their families to help the unfortunate victims. Let us also be sharers in that by educating others as how to prevent and how to go ahead.
Thank you, ma'am. So nicely said. Need to have a heart of gold, literally. So two things on this. One, for you to imbibe that sense of compassion, which we are all born with literally at once, and that's why we are in this profession. Like I said earlier, assume that everything around you is all surrounded by COVID. Then you will take all the precautions. And assume that all the people around you are all your loved ones. Maybe the beggar, the driver, the one in the shop, and the one who is in front of you. They're all your loved ones. Would you be discriminating them if they get a illness which is transitory and 80% of it is mild? And it's not even their fault. We're not talking of a sexually transmitted disease. It is something which probably they picked up because of somebody else's fault or their own. But would we discriminate against our own loved ones, our own parents, sisters, brothers, cousins? No. So ensure that this factor sinks into your mind that COVID is around you, but the ones who are around you, those people are all your loved ones. Now, the second one, when you have to do this, it's a very simple ask that you do your duty. Remember how you used to feel so proud about the warriors who were there at the border and defending us? This is our time, literally our time. And the only people who can save the nation, the state, and even the neighbor beside you is you. You are given that responsibility, and now is the time. Never before has medical profession reached this level of importance and garnered this amount of praise as well for all the good work you did. So whenever you feel you're getting discriminated, please reach out to the concerned people. Tell them this is it. Once, as I said before, information is the only thing that will empower you. And whenever you feel you are unnecessarily and unknowingly discriminating against somebody else, could be a COVID positive patient in the ward or your neighbor, ask yourself if you would do the same thing if it were your loved ones. Thank you so much, ma'am. Now we quickly go to the last few questions. On the crowd, it is very important for us to stay safe after lockdown when everything else is opened up. Even restaurants are opened up. Crowding is there everywhere. India is the second most populous country in the world. We can't get rid of people like this. So how do we still stay safe despite the crowd which is around us? Rajeshwari ma'am, quick answer on this.
Yes. The more the people recently, so many incidents we have seen, like wherever we got the more number of COVID positives, they were having like a gathering, either maybe a birthday celebration or some occasion in the home. So that is due to the gathering only, like maybe some people there with the positive and almost all got the positive thing. So the more people an individual interacts with at a gathering and longer that interactions lasts, the higher the potential risk of becoming infected with COVID-19 and COVID-19 spreading. So the higher the level of community transmission in the area that the gathering is being held, the higher the risk of COVID-19 spreading during the gathering. So we like the size of an event or a gathering should be like determined basis on the state, local. Now they are limiting. Even in the marriages and all, they are begging to a number like 50, 20 like that. So we have to think before going, like what is the risk, what is going to happen if we are not going for a gathering or not calling for a function or something like that in the house. In the community, like the other day, we have seen our India map when it came, the Telangana is having community transmission for 122%, I think next to Delhi. So this is what, like if we people are not taking the responsibility and avoiding the gatherings, I think we have to face the problem at the end. So when we talk about the risk of COVID-19 spreading at the events and gathering increase as follows, like lowest risk, virtually activities like going online classes or online talking to the people, even with the families. Once upon a time, there were no phones and all. But now everything is available on internet. We can see video, we can call video, and we can see our people, whoever there, even how much far also. So we have to concentrate on that and see that we will go for online, that virtual activities, most of the virtual activities, even now these webinars and all. Once upon a time, we used to gather and do the things. But now we are going for these online webinars and workshops because of to avoid the gathering. So these things will have less risk. But when we talk about the social gatherings, when it is a smaller outdoor and in-person gathering, we can go for a more risk. And if it is the number is more, then we can think about higher risk. And if it is more than 200, 300 people gathering together, it is the highest risk of the thing. So we have to think when we feel that it is a must, the gathering also, we have to maintain the social distance and still try to minimize the people. Like people has to come for meeting. So with the companies, and the people has to think like whether all the people has to come, like if we can survive with the 50%, try to minimize the people, calling them, and so that we can minimize the transmission of this, because we people stays in different places. From different places we are coming to one place, then there is a chance of spreading, because we don't know with whom we are mingling. We know up to our family, but we don't know who is neighbor to us, whether he is a positive or without symptoms he is having positive thing. So because of stigma, people are not coming out also to tell that they are having the problem. So these all things we have to keep it in mind and see that we will avoid gathering unless it is a must, and see that we will make it that also we will minimize the number, and we will try to go for virtual meetings and other things, so that
Thank
we
you,
can
thank you, ma'am. Thank you.
spread.
So work will carry on. We just find a new normal way of doing it. That's the take-home message. Uma Shankar, there's so much of information that comes to us. The only difference between the earlier pandemic and this is the ongoing pandemic of information. Let me ask you very specifically, there's so much of COVID-related information. Which one should I rely on? Uma Shankar, you may unmute yourself if you're around. Uma Shankar, could you respond, please?
Yeah.
Yeah, go ahead.
So this is regarding the kind of informations that we generally getting from different sources. So most importantly, what is happening is nowadays with the advent of social media, which is very much there. In fact, everywhere we need to actually understand where that information is coming from and what is the genuinity of that information that we are getting. So as of now, we are getting whatever informations that are there, that has to be verified, and most importantly, we have to believe that information that has a source. Was basically the Ministry of Health and Family Welfare website, which is called www.mohfw.com, is the valid kind of and a verified information that we get. Otherwise, lot of information that is going around in the websites and the WhatsApp, which is creating much of the problems in different places. What is happening is you are getting rumors in the WhatsApp saying like if you drink too much of alcohol, corona will not be there. And in somewhere it is saying like if you take ginger liquid and that salts and all, you will be free from corona. So all this kind of information that are going around in WhatsApp, please avoid and search for a genuine information that is available in only ministry's website. That is what I told is Ministry of Health and Family Welfare. Next slide. Please don't believe in all those informations. Next is the national toll-free help number, which is there, is 1075, and state helplines are there. In your Telangana state, there is a state helpline. Definitely please call those numbers and definitely take all those information that you require, and also guide the community that you call 1075 for the informations.
Thank you, Uma Shankar. That brings us to the last question, and a very important one. May I now request Professor Annie to please tell us, what do we now seek where do we seek support, or what do we do in case we are anxious? It may always happen. Imagine if you hear the news of your very close friend or your loved one who is tested COVID positive. I'm sure your heart will skip a beat, mainly because you have seen the worst end of the spectrum. You've seen, you're working in a hospital where you're taking care of people on ventilators, and now you have come to know that one of your loved ones is positive. And not just this, just the amount of information that reaches you itself puts you into this distress. Sometimes you feel you want to go away from all of this, go into a corner where no information comes to you, and then come back after all this settles down. How do we take care of ourselves in such situation, and what do we do then? Professor Ann, please, the last question of the night.
Yeah, I would like first and foremost to mention few points on psychosocial impacts and why, who is affected. There are researches being done, and we have a few materials available. First and foremost, corona positive, a stigma almost. Just like 2003 SARS, even after years, the care providers as well as those who were affected were supposed to be isolated or some kind of stigmatization. And same thing is happening with corona positive. And therefore, what is happening? By and large, people hesitate to say that they have corona or the symptoms of corona. They don't go to get medical help. They don't give proper medical history, nor do they give travel history. These are some of the problems that we are coming across these days. Another thing is that psychosocial burden of quarantine and isolation. Because of quarantine and isolation, some of the problems that we come across is quarantine can vary from immediate effect like irritability, fear, contracting of and spreading infection to family members, anger, confusion, frustration, loneliness, denial, anxiety. And I can list out still more. And again, we have the people who are affected sometimes, or somebody in the family affected, they can also get into obsessive compulsive behaviors. For example, continued washing with soap, continuously taking temperatures. So these are some of the manifestations. And also we have what is called post-traumatic stress disorder, which is again been reported, and symptoms of which have been positively associated with the duration of the quarantine. Depends, it is a longer time or a shorter time. And healthcare providers are likely to perceive greater stigmatization than the general public for being quarantined, and consistently more affected psychologically. So, and again, I would like to mention a few more things. We have, as you said just now, there are disinformations, misinformation through social media, like WhatsApp, Facebook, Instagram, and Twitter. And they have started making business about COVID. And therefore, it is very, very important. And its impact on mental health of people are too many. And then again, families during an infectious disease or outbreak may exact an enormous emotion toll on healthcare providers and increase the risk of developing profound anxiety regarding the fear of transmitting the diseases to their own family members. There are also special groups like effect on special group of the society like children. These days we hear children, for example, now we have online classes going on. Luckily or fortunately not the older ones. From the younger group of students, there are families who can't afford a smartphone, can't afford a PC, and therefore can't afford even recharge. So there are suicidal attempts, suicidal cases being heard these days. So this is, and the children, they are supposed to be in the park playing, all that has been shut down. They do not have any more, the closing of the schools, parks, and playgrounds will disrupt children's usual lifestyle. And as a result, they are potentially they are likely to be changing their behaviors as well. They can get into they can get into depression. Face-to-face contact with the classmates are not there. I remember even our own grown-up girls. They said, sister, enough of this holidays. We would like to come back to hostel, our second home. If adults feel so, I can wonder children how much. So interaction with the families are there, and then what at old age people they are more vulnerable, and they also behave during this time, and they also may have some comorbidities, and therefore anxiety, worry, agitation, all that seen on them. Domestic caregivers are another marginalized community, migrants, daily wagers, slum dwellers, and prisoners. These are another group which is very much affected. I have seen personally when, fortunately, we had gone to railway station, bus stand, and all to provide some provisions, some food. And I've seen the last when I went, what I had seen was a serpentine queue from the railway reservation to the road and to the bus stand. And there are the children, adults carrying heavy luggages, bags and baggages in the scorching sun. We can imagine, we are hearing that 600 kilometers they walk, pregnant women, children. We can imagine the psychological impact on all this. Now to cut short, and of course on the healthcare providers, there's another home quarantine for the homeless, another for the homeless where is the possibility of the social distance? Where is the possibility of, I've seen at least 50-60% no mask. We try to distribute where to reach. So effect on people with the pre-existing psychiatric illness, it's even more. So then what are we going to do? So the psychosocial problem, fortunately, the nursing profession has one subject, psychology, and also guidance, counseling. These are part of our training, and therefore the healthcare providers, the nursing professionals, and I would say even without training, a mother can find out from the child and something is going wrong. It is to be it is to be observant. It is to be concerned, caring. One can find out for any of this effects of the psychosocial effects. Another big problem is the breadwinner has no more the job, and the economic shutdown. Another reason for what the future holds for. No one knows. The family may be in utter poverty and without any food. Mass suicide may be expected, and therefore it is important as individuals and as governmental agencies, non-governmental agencies, we need to address these problems at a very, very large way, a greater way. Just to mention a few interventions. For example, for panic, depression, and so on, communication channels had to be secured. Close monitoring of mental state of quarantine, people who are quarantined, not enough to give food, drink. We also need to closely observe to see what is their mental status, and through a smartphone, in-time referral, psychotherapy, and stress adaptation models. And the healthcare providers, what can be done? Support from higher authorities. I can praise the people, the human beings, the philanthropists who went on 12th May to Cancer Hospital, MNJ, and they have felicitated and they have done something to tell the nurses, tell the doctors, healthcare providers that they are greatly honored and loved by the country, by the state, and therefore support from higher authority, clear communication. When I say higher authority, not enough, I don't want to criticize, but not enough to put flowers or garlands, but we need to see, for example, some Western countries, they have increased their salaries, increase the salaries to see to the to see to that the justice is done. So clear communication, regular, accurate updates regarding the precautionary measures, sustained connection with the family, arrangements and for well-equipped isolation. Even today, I saw some philanthropists went with the PPE to MNJ to mean to say that PPE for the healthcare providers. The importance, if the government is not able, but we have so many good-hearted people trying to reach out together with the government. That's why I said we need to work together. And then what about children? Proper parenting. Before people, parent had no time for children. Today they are together with the family, give time for their parents. Sorry, parents give time for the children. Online classes, online study, they need to be supported. Clear and direct, open and detailed information about disease transmission and precautionary measures. Maintenance of sleep cycle, physical exercise schedule, educate about proper hygiene practice. What about old age? And their problems are irritability, anger, fear, anxiety. How do we enter into to do something? Home-based physical exercise during quarantine, sessions via telephone, online video conferences for physician guidance and mental health services. And again, home-based physical exercise sessions via telephone. Okay, coming then to the marginalized community. Protection of basic human rights. We can see there are so many activists on the field. And to the extent they have moved even the court to see that the migrants are reached home. Lucky are we if we could convince the migrants and if we had kept them back as we had done, to take care of them, to take care of their families.
Thank you, ma'am. Yeah, we'll now take up some questions. We're left with just 10 minutes. Dr. Sri Selam, if you could quickly in a few minutes take up the questions and give us brief answers.
Yeah, Dr. Sri Krishna, there was one question regarding the hydroxychloroquine prophylaxis and corticosteroids. Excellent. They are concerned. That is what I understood. The hydroxychloroquine prophylaxis to the healthcare providers is given after a thorough check. Usually, it should not be taken as a self-medication because hydroxychloroquine is a very toxic medicine. Though it is seen, this toxicity is seen in very few people. Now, one of the major concern of hydroxychloroquine is with the cardiac problem. So whenever they start hydroxychloroquine, they ensure that a simple ECG is taken. Why? What do we look for in the ECG? Whether there is any prolonged QT interval. Because hydroxychloroquine also causes arrhythmias. Suppose a person who is having this problem, a prolonged QT interval, which is sometimes congenital in nature and sometimes because of the other cardiac problems. So what happens? He lands up with fibrillation. So it is a very fatal one. So is in the case of monitoring also. Whenever they put on hydroxychloroquine prophylaxis, they frequently get the ECG done. There are other reversible effects with the retina, and there are some of the very high doses which they are not giving. It causes retinal damage. Of course, there are milder symptoms like dizziness, crampy abdomen, diarrhea, stomach ache. All these things are there. But this hydroxychloroquine this is one of the major adverse effect. And another question was regarding the corticosteroids. Again, I said these things are being circulated in WhatsApp group. Majority of them are trying to take out self-medications, thinking that they are COVID positive. So out of fear, they might do it. Always it is under the guidance of a doctor. Never take these medicines, though the doctor might write the same medicine which you are thinking that you might require it, but it is under a professional advice. Now, regarding the corticosteroids, majority of them have the effects on the hypopituitary axis. There are cardiac problems like hypertension. There are problems concerned with the bones, osteoporosis. They are concerned immediately. Some of them will get gastritis. They might be GI bleeding. Some of them might even get epistaxis, bleeding from the nose. So how do they manage? Some of them are getting bone depression. The question was regarding the bone depression. Usually that bone depressions are at a very high doses and over a long period of time. Now, in a COVID patient, the steroids are given. They frequently monitor the blood picture, the complete CBP, what they do. They check for the neutrophils, lymphocytes, and the platelets. So in that way, they monitor the side effects of the corticosteroids. The one of the most common side effect is a Cushingoid faces. They get a very, they become heavy, they become very fatty, the deposition of the fat occurs. These are all reversible changes. I think the doctor who is prescribing you, he'll definitely counsel you about the side effects also, and you to be what are the things they should alert you. So I think that should not be a matter of concern. That will be more professional and individually approach.
Thank you, Dr. Srisalam. Let me just take up the remaining ones. Effectiveness of Fabiflu or the new drugs. As we speak, no, there is no need for you to take it as yet. There are many things which are coming up as research. Let me repeat, this is a new virus. Nobody knows enough about it, and we are in the process of learning more. Earlier, we said no mask for everybody. Now everybody is wearing a mask. If you don't wear, you get a fine. So things will change, and it's up to us to adapt to the change. As of now, no. Probably in a few days, it may be very much relevant for those mild cases. Next, and the same holds good even for the other experimental drugs. Then pandemic pregnancy, what precautions they need to take? The same precautions as they would take if they were not pregnant. Only additional point being that they need to focus on their nutrition very well. And there is so far no transmission from the mother to child through the umbilical cord. But nevertheless, the precautions we continue to take. There are many women who have delivered despite COVID, and many who have not had major complications as well. So do not worry if the pregnancy sets in during the period of COVID. You anyway could not be able to help it. Next, once we're affected with the virus, can we get it again? Each time when there is an antigen in the body, it causes an antibody to be produced. These antibodies have a specific life up to, let's say, 30 to 90 days, after which the antibody titers come down and then you become predisposed for the virus again. Frankly speaking, if it has started in March, that 90 days has not even completed. So we really don't know the answer. But it has been observed that for a prolonged period, the antibodies will stay. And it is unlikely, correct word is unlikely, that you will get affected again. But until those antibodies go away and then another person comes positive, we really don't know. But the precautions which you should take will continue. Even if you have been COVID positive, you will continue to take the same precautions. We have already addressed the question on the traveling and also precautions which you have to take with respect to the use of mobile. And any other questions, Dr. Srisalam? How to take care of immunosuppressed clients, mentally disabled people, migration, vulnerable group? We have seen these questions get answered, wherein they are also equally vulnerable. They may have an aggravated response. So the precautions need to be adhered very strictly. There's no new formula for them. It is just adherence to the same precautions which are applicable for the general population. It is just that, no, it's like we're all like the batsmen in a cricket match. One bad ball and it doesn't matter. You have spent 49 runs, you get out on the 50th ball. So 50th run ball. So you continue to take precautions. Assume that the next minute the virus will come to you, and be informed, yet make sure you are not letting your guard down. If you are taking care of yourself well, simple measures if you can follow well, then it will work. You don't need a complicated new system. We know what is important, what needs to be done. If you can do that, that should help. Any more questions, Dr. Srisalam, from the chat box?
Yeah. I've seen so many questions regarding the therapy treatment. What I would like to tell is there's a big bombardment of the various guidelines, various treatment protocols. So what I would the whole essence of this program is focusing on the prevention part, because these guidelines keep on changing. The treatment varies from, for example, in Chennai, they saw some medicine is very effective. In Maharashtra, in Mumbai, it is different. In America, it is different. In China, it is different. So let us not be confused with what all the treatments going on. The standard protocols with the proper guidelines, it is the responsibility of the treating doctors and the hospitals over there. What as a COVID warriors, we as a medical healthcare professionals, what we want you all to learn is these essential things to bring the behavioral changes, not only within you, but also the surroundings. Why? Because prevention is better than cure. So the more stress should be on the prevention part. The things, how we can improve the immunity, wonderful. It's a preventive measure. Exactly. There are n number of information regarding the how to improve the immunity, be it herbally. For example, you see the increase in the sale of Chyawanprash. There is no harm. Do not discourage. Some of them might say, drink a tea, kada tea. Good. It doesn't harm you. You take ginger. It is helpful. Take. There's no harm. Those things, I think the information has to be carried and it should be encouraging because they give emotional support also. They bring a ray of hope to all the people around us. So I
Dr.
would
Sri
like,
Salem,
yeah.
let me ask you this question as you answer. So will having all this, will it cure corona or will it prevent corona? Is there a drug for it?
That's a very tricky and challenging question. Why? Because it all depends on the individuals. There are people with a simple paracetamol, they are alive and they did not have any complications. There are people who have been ventilated with all the efforts and treatment. They have come to coronavirus. It all depends on the immunity, the viral load of the individual, the age of that person, and the comorbid conditions. What are the other problems that individual might? For example, a person with diabetes or cardiovascular disorders, renal failures, kidney problems. They are the persons who are very prone to all high incidence of mortality in them. So as an routine normal public, I think we should all be having that confidence that I'm not going to die and I'll not let others die. It is not dreaded disease. It is only because of the the spread, the contagiousness of the virus is so high. We never know 10 among the people who are affected, who will succumb to this. The main purpose of this program is prevention. So we want you to prevent yourself, prevent others also. Do not read the news of the deaths which are occurring. If you look into the deaths, they are all either debilitated patients, immunosuppressed patients, immunocompromised patients, smokers, alcoholics, drug addicts. Those are the people, are the very old people. They are the ones who have been.
Thank you, Sri Salem. Very nicely said. It can come to anyone. Anybody, even amongst us, in the due course of time could be COVID positive. But it doesn't kill anyone. You will have to have low immunity and the virus load has to be very significant and some comorbid condition must predispose you, then it gets into life-threatening. Otherwise, even on, let us say, 24th of June, 80% of the COVID positive cases are mild. So it can come to anyone. Take all your precautions, but don't be scared and have a mental depression and worry about it and take up behaviors which do not help you or your family members and friends. Be confident, learn from the correct resources, and then you'll be happy. I've circulated a form in the chat box. Request you all to please share your feedback there. We'll be doing these webinars more frequently, and we have plans to do it along with TNAI also. So your feedback will help us in planning the sessions. I have exactly 3 minutes to wind up. Before I thank everyone, let me, over a period of 2 minutes, take you through a nice story. And this is the last parting session. So this is an analysis of 3 COVID outbreaks, how they happened, how they can be avoided. So we have 3 scenarios: an office, a restaurant, and a bus. And then they studied what exactly happened. Why did so many people come positive? The first one is the office. So there was the single wing of a call center in Seoul in South Korea. The risk of infection multiplied by 4 factors, which is closed, prolonged contact between numerous people in an enclosed space. What exactly happened? This is how they were there in this call center in this particular floor. They were working. together, maintaining a little distance as they always do. On some desks, such as this one, 9 of the 13 employees tested positive. And these employees were sitting inside an enclosed space with about 137 workers. And out of that 137, 57 of them tested positive. And the permanent contact within the same space over a prolonged period of time is the one which played the crucial role. There were some more employees on the other end, like this. Only 5 employees working on this side of the office tested positive. And in the rest of the building, only 3 people tested positive. So, what can we do to avoid this? First, ensure that there is natural ventilation to avoid recirculation of infected particles. Avoid concentration of employees in meetings and try to make sure you have available space. Keep the staff distanced. Try to do teleworking and organize your workstations like this in a zigzag pattern so that there's at least 2 meters of space. Do not have any physical contact, no sharing of material. These are the things that you can do. This is the first setting. This is the second one is more interesting. A New Year's meal in the Chinese city of Gangwon on January 24 told us how to reduce the indoor risks. What happened? So this is that restaurant, and these were the people who had come in, just like any other restaurant. So the restaurant was full on that day. There was no natural ventilation. 90 people were eating. On table A, see this person here. He arrived the day before from Wuhan, and that person was not stopped, and he showed symptoms and then went to the hospital that night. But that evening, he came here to have his dinner. After the meal, what happened? Another 9 people were diagnosed positive. Who were these 9? Those who were close to this table. So table C and table B. None of the others were infected. And the length of the time is critical. See, the meals of families B and C overlapped with that of the patient for an extended period. They also observed that table D overlapped for a very little time, so only for 18 minutes. So B and C, they had more positive patients rather than table D. What can be done? Air conditioning was a crucial role because it's an enclosed space and the virally charged microdroplets were found to be expelled into the atmosphere. I'm not talking of airborne spread. I'm talking of contact which increases because of this. How can we avoid it? Open the windows. Wherever you are, ensure that there is circulation of air. Avoid background music. Small things that make a big difference, isn't it? Avoid this background music so that people don't raise their voice to talk. They'll talk slow, they'll talk less. And so less of the droplets come out. Avoid the recirculation of air, use air filters, and see how they have spaced it now. Zigzag pattern, at least 2 to 3 meters, much better. Keep this table outside. Shift this table B or A outside and try to hold it away from each other. The third one is of this bus. They found that the large number of people were traveling by this bus, and like it always happens, you can't maintain distance. So many people were close together. There was one woman who was positive, and 23 people got infected on that bus. And the air conditioning was again found to be the problem, along with the fact that they were in an enclosed space for a large amount of time. The most important point from today's webinar is this. Please look at this inverted triangle. How can we avoid all this? And this is all science. This is all evidence which has told us. This is the effectiveness and the measures. What we are doing most of the time is this mandatory use of non-medical masks. Effectiveness, yes, it is very effective. But what is more effective is physical distancing. You must not neglect this. Physical distancing is found to be the most effective. So try to have teleworking, try to work from home, reduce the number of employees in offices, engineering control, wherein you create physical barriers between people. Don't underestimate the opening windows or the zigzag pattern of sitting. All these contribute a lot. administrative control like redistributing the responsibilities so that you don't unnecessarily make contact with people. So like this, they have understood how the importance of physical distancing, social distancing is going to help us stay safe. So that's all from my end. And I thank all the panelists for their valuable time. And now I hand over to Dr. Vidyulata to close the session.
Thank you each and everyone. Madam Renuka Devi, Assistant Professor of Government College of Nursing, Hyderabad, will propose vote of thanks.
Good afternoon to one and all, and congratulations for successful completion of today's webinar. I am Ms. K. Renuka Devi, Assistant Professor, on behalf of Government College of Nursing, Hyderabad, and Fraternity of Nursing. Extend a very hearty vote of thanks to Dr. Ramesh Reddy Garu, DME.
I'm sorry, if you could please unmute yourself. Vidyulata ma'am. Yeah, please go ahead.
I am Mrs. K. Renuka Devi, Assistant Professor, on behalf of Government College of Nursing, Hyderabad, and Fraternity of Nursing. Extend a very hearty vote of thanks to Dr. Ramesh Reddy Garu, DME, Government of Telangana. I wish to express my gratitude to Dr. Mrs. B. Vidyulata, DD Nursing, DME, Government of Telangana State, along with the support of UNICEF, Hyderabad, for organizing this webinar. I must mention our deep sense of appreciation for Moderate Dr. Sri Krishna R.S.V., UNICEF consultant, for his explanation of COVID appropriate behaviors. Further, we are grateful to panelists Dr. Sri Shailam, Vice President, IAP Telangana.